So today we will discuss some of the important key points in each fungus. Okay. So first it is in Tinea versicolor, which is caused by Malassezia furfur, and in KOH you can say spaghetti and meatball appearance, that is like noodle shape. Okay, so it will be like a noodles and meatballs. And then in culture it is like fried egg colonies, and in woodlamp you can see golden yellow fluorescence. If you come across these points, you can make it sure that it is a Tinea versicolor. So next it is a Tinea nigra, which is caused by Hortae ventnici, and most commonly it is seen in the palms and the soles, and most common in the females also. And it is in black color yeast fungus, that is it belongs to phioid groups. So next coming for white pedra, so it is caused by Trichosporon vegetae, and here urease test is positive and it will be having an arthrospores. Again the arthroconidia it is seen in coccidiomycosis. Okay, so here this will causes a nodules in the hair shaft, but it is less firmly attached to the hair shaft, whereas black pedra is caused by Pedra hortae. It is in phioid fungus, black. So all pigment producing fungus belongs to phioid group, and here there will be a nodules in the hair shaft which is firmly attached to the hair. Okay, whereas in white pedra the nodules will be loosely attached, whereas in black pedra it is firmly attached to the hair shaft. So next coming for dermatophytes. So just remember three species: Trichophyton, Microsporum and Epidermophyton. As the name indicate tri, it will be affecting three, that is skin, hair and nail. For Microsporum, it is in skin and the hair. You can remember like melanocyte stimulating hormone, M. Okay, M, S for skin, and H. Next is Epidermophyton. It affects in nail and the skin. This you can remember like enteric nervous system. And Microsporum it is MSH, and here Epidermophyton it is an enteric nervous system. Trichophyton, Microsporum and Epidermophyton. You can remember like TME. Okay, and just remember like PSC. Okay, or you can also remember like PHC. So or PSC. P for pencil, S for spindle, C for club shape macroconidia. And as to you remember, for microconidia it is a tricho. Tri means many, so there is an abundant microconidia, whereas micro means less, there is a less microconidia, whereas Epidermophyton it is an absent. Okay, just remember like TME. Okay, and PSC. For microconidia, I told already, tricho means more, so abundant, Microsporum less, so single or very less, and Epidermophyton it is an absent. These are all the superficial mycosis. So next we will go for subcutaneous mycosis key points. So first is mycetoma. So there is a triad here. One is tumor like swelling, discharging sinus and granules. If we come across these points, it is an mycetoma. And here there is a eumycetoma and actinomycetoma. So this eumycetoma, the most causative organisms are usually bacteria, and it will be producing it is a fungus. Okay, so it will be producing a black and white granules, whereas actinomycetoma it will be producing white to yellow or pink to red granules. Just remember eumycetoma it is caused by fungus, whereas actinomycetoma it is caused by bacteria. Next, what are the clue words for sporotrichosis? First, it is a rose gardener disease, and there will be a history of thorn prick. Okay, if there is a given case history, sure there will be a history of thorn prick. or it can be produced as a body which is called as an asteroid body. And splendor hopefully phenomenon, it is in pathological finding, and it is like a flower like pattern, okay, like this. So it will be in flower like pattern, and there is a test called as a sporotrichon antigen test. If you come across these points, it is in sporotrichosis. Next, for chromoblastomycosis, this member it produces sclerotic bodies or medullary bodies or muriform cells. So these if you come across these 3 points, it is in chromoblastomycosis. Next, it is in pheohypomycosis, that is in pigmented fungus. These all produces in black colonies. Just remember A, B, C, D and E. Alternaria, bipolaris, carvularia, Drischleraria and exophilia genselsby. You just remember the name, that's enough, okay. So no need to remember the morphological structures that and all. Just remember the names of the pigmented fungus. And next, coming for rhinosporidiosis, it is an if there will be a history of bath in the contaminated ponds or any water source, and diagnosis is usually by spherules which containing a numerous endospores, and by clinical history there will be a large friable polyp usually present in the nose. Okay, if you come across these points, these are the hint for rhinosporidiosis. Plasmosis. First, it is called as an Darling disease or Caver disease or Ohio River Valley disease. And always remember, histoplasmosis usually resembles in tuberculosis. At 25 degrees Celsius, it produces a tuberculate macroconidia, and there is a skin test called histoplasmic skin test. Tuberculate like this, there will be a circular and there will be a spiny projection. That is in tuberculate macroconidia. Coming for blastomycosis, this is called as a North American blastomycosis, also called as a Gilchrist disease, also called as a Chicago disease, and it is produced broad-based budding and figure of 8 appearance like this. Okay, you can remember like B. Okay, so B is like 8. That's all. Coming for coccidiomycosis, it is also called as this is rheumatism, valley fever, California fever. So the main characteristic feature here is it produces a barrel-shaped orthoconidia. Okay. Next, coming for paracoccidiomycosis, it is also called as in South American blastomycosis or red splendor de Almeida disease. It has a pilot wheel appearance or Mickey Mouse appearance like this. Okay. So pilot wheel or Mickey Mouse appearance. So next, for candidiasis, what are the key points you'll come across is, first, it is in gram-positive oval budding yeast cell with pseudohyphae. That is an important point, and it produces a creamy white colonies. Germ test tube is positive for candida. Okay, so whereas rest or other species, the germ tube test will be negative, and it produces in color in the chromagar, and there will be a growth at 45 degrees Celsius. You can also differentiate by sugar fermentation, assimilation and id reaction. So if you come across these points, it is in Candida. So next, for cryptococcosis, first it is in capsular staining, that is negative stain or nigrosine stain, and musicarmine stain, it is for staining the cell wall, and Masson Fontana stain usually for melanin, and Niger seed agar or the blood seed agar, it is a culture medium for the Cryptococcus neoformans. These are the points you want to remember for Cryptococcus neoformans. And so first, for zygomycosis, it is in diabetic ketoacidosis. There will be history of diabetic ketoacidosis or renal disease, patient taking any iron therapy, that is a desferoxamine, or in culture it will be a lid lifters or some clue like salt and pepper appearance. If it is a salt and pepper appearance, it is in rhizopus. Okay, so if you come across these points or any history of black discharge or history of any nasal mass, these are all points in favor of zygomycosis. Okay. penicillium. So penicillium means, first you want to remember, it is an, for PCB it has a brush border appearance and it produces green velvety colonies. Whereas Penicillium orphanefi, it is a thermal dimorphic fungus, it produces a brick red pigment, okay, and it is the most common infection in the immunocompromised and HIV patients. And pneumocystitis, you will come across these points like frothy exudate or plasma cell pneumonia, and then the crushed ping pong appearance in the histopathology, okay. So if you come across these points, you can make sure you are going through pneumocystitis. So these are some of the clue points or the keywords, whatever you can, okay. If you come across these points, it is a clear cut of the particular fungus. You don't need to think of any other fungus. So these are some of the clinch points for the diagnosis. Thank you.